back to my channel. I am Kuratulan, your host. We are preparing Nclex RN together. Okay, so we are on single parents. Last time I have read about COVID-19 and homeless. Now today chapter 5 unit 2, and we are going to read single parents. As you know, it's a general idea. Everybody knows that single parents has quite a difficult life. They encounter lots of difficulties in their lives. Or here in Nclex we are going to read about like on Nclex perspective. Okay, so what they are going to test in exam, there are some pyramid points. It is really important topic as well. To be honest, guys, I would say that every topic is important in Nclex. We cannot ignore anything here. So we are going to read single parents. Stay with me. We are going to read word by word, and then I have uploaded already practice questions and answer. Hopefully it will be helpful for you. Okay, so I'm not a teacher, I told you already, I'm not a teacher, but I have 15 years of experience in nursing, and I have passed my NCLEX in first attempt because I have read word by word and NCLEX like sounder book. I have digested in myself, so that's why I'm just sharing with you guys. Let's start reading. We will not waste our time. We will start reading and then go for practice question and check your ability, and then we are going to start next video will be chapter 6 as well. Do not forget. Okay, let's go and start. Parents, here you see this is a pyramid point, and it is really important point, guys. As you see, we cannot ignore this when we are reading this. So the nurse should establish a therapeutic relationship with the client and encourage the single parent to express any concerns and needs about single parenting. This information will assist the nurse in identifying appropriate resources for the client. So guys, here look, it is a pyramid point, and here it focus on therapeutic relationship. Okay, so they will not ask directly therapeutic relationship. Maybe they will create a scenario, and then you have to choose option related to therapeutic relationship, and encourage the single parent to express any concern and needs about single parenting. This information will assist the nurse in identifying appropriate resources for the client. Here you guys know. Now it's B, initiating. I will. Initiating access to community organizations can assist in alleviating some burden and in providing needed services such as childcare, food security, healthcare, including immunization and employment. So yeah, guys, here I'm reading, just focus word by word. Okay, what I'm reading, try to understand. You all know English is not my first language, but I'm just reading. Okay, so hopefully it will be helpful for you guys. Number C, chapter 5. Look here, population health nursing, page number here in the book. Okay, no. So let's go, guys. Here, see, the nurse may need to assist single parents to address the child's sexual development, especially those with a child of the opposite sex. Number D, preventing screenings are important in this population due to risk factors and the negative effects of stress from single parenting. Okay, guys, here so now this is here we are going to read foster children. Foster children, sorry. So number A, needs that often go unmet for children in foster care include physical, mental, behavior, and dental health. This increase the risk for health problem later in life. Some children in foster care may have complex and chronic health conditions. So we cannot neglect as a nurse foster care as well. As a nurse, you have to take care of single parent, foster children, homeless guys. So you are all arounder. Okay, as a Nclex RN, you should know all these things. Knowledge is power. You are going to gain all knowledge here. So see, Look here, this is a pyramid point. I always say this pyramid point never ever miss if you want to successful in your exam. Here it is. Healthcare considerations for foster children. Community resources are important for this population to facilitate the provision of health, safety, stability, and permanence. Social workers must be included in the care of a foster child to facilitate access to community resources. Never forget social worker, community resources, okay. Medically equipped homes may be needed as well as in home nursing care service for those children with complex or chronic health conditions. Number 4, frequent health visits may be needed for children transitioning to and from foster care. Then here individuals with mental health problems. Here we are going to read about now mental health problems. Okay. So number A, lifestyle choices, chronic health problems, psychotropic medications, limitations in access to healthcare, and lack of preventing screening are concerns. B. Side effects of psychotropic medications may contribute to an altered health state. Certain psychotropic medications can contribute to weight gain. Listen here, guys. Certain medications can contribute to weight gain, so we will keep in our mind. See, lack of exercise and poor diet, as well as features of an illness such as depression or disorganized thought process may contribute to health problem development. We are reading here mental health problem, so we are expecting to read all this. Side effects from psychotropic medications such as sedation, weight gain, and increased appetite contribute to the incidence of diabetic mellitus and metabolic syndrome in this population. Okay, due to the higher frequency of substance abuse, risky sexual behaviors, and lack of knowledge regarding risks, individuals with a mental health problem are at increased risk for sexually transmitted infections. Number F, sexual dysfunction can result from the mental health problem as well as the medication need to treat it. Number G, urostomia from reduction in salivary gland salivary gland flow due to medications can result in difficulty maintaining oral hygiene and overall health. Here again, this is a pyramid point, and I'm thinking to make a video all pyramid points in my video of each chapter, so you guys, when you are before going exam, might be you can just focus on these pyramid points. So here, healthcare considerations for individuals with mental health problems. Look number H. And number 1, we are going to read carefully and listen carefully here. 1. Individuals with the mental health problems have a difficult time to accessing needed and available healthcare services. Number 2. Family and social services support are important for these individuals. Governmental insurance has expanded to cover individuals in need of mental health care. Mental health screenings must be completed regularly for all individuals, which allow for prompt and accurate treatment strategic to prevent further health complications. Number 5. Refer to the mental health chapter for additional information about this population. Mental health is very, very important in Nclex, and we have a full chapter. Soon we are going to read, hopefully, that's older adults now. So, listen carefully, guys. Older adults, a new topic here it is. So, elder abuse is a concern for this population. Healthcare providers are mandated to report if there is suspicion of elder abuse, because elder abuse are really common there. So we have to be careful if they are. We will see the sign and symptoms if they are being abused by someone, sometime from nursing staff as well, from hospitals, sometime from relatives. So these are the concern that we have to see. The most common type of abuse is neglect. Neglect means negligence. We don't care about elder older clients. That's why. B. Many health problems can occur in the older client. Box 5.5 lists home some of these health problems. Bare boxes. Never forget, I already uploaded a lot boxes in my community area and YouTube. If you want to see, these boxes are there, and I am making shorts about boxes as well. If you want to just have a look or maybe just remind yourself. See, see chapter 20 for more information on common health conditions experienced by older adults on the care of the older adult. So guys, chapter 20, as I said, we are going to read each chapter, so we will read chapter 20 as well. So, military veterans. A. This population is at increased risk for injury related and stress related health illness. B. Mental health or behavioral adjustment disorders are common. C. Substance use disorders with tobacco, alcohol, or other drugs and suicide are more common. D. PTSD and moral injury are common among this population. E. Traumatic brain injury can occur as a result of external force injuries. So military people, we can just have idea when they are, maybe they have mental health behavior. I mean, there are a lot of problem related to this group as well. So this is here box 5.5. Okay, I will have a look, glance on it. Box 5.5, health problems that occur in older adults. Alzheimer's disease, as you have seen maybe in your wards, arthritis, dementia, depression, falls, heart disease, influenza, obesity, oral dental health problems, osteoporosis, pneumonia, poverty, respiratory disease, shingles, substance abuse. So, F now. Limb amputations and disargument are more common. Limb amputations and disfigurement are more common because when they go for war, they go for fight, or maybe they have operations kind of, and then they will have a gunshot on legs mostly, and then they will have limb amputation, and after the disfigurement, mental health problems are more common as well. G. Long-term health problems may result from exposure to chemicals and environmental irritants. Military veterans can experience issues leading to homelessness. I. Healthcare consideration for military veterans. Identifying and treating mental health problems assist in mitigating suicide risk. Number 2. Treatment of comorbid conditions such as PTSD or moral injury may help to address substance use disorders. The use of screening tools in identifying substance use disorder will help to plan appropriate care. 4. The U.S. Department of Veterans Affairs can assist in managing some of the health issues experienced by these individuals. Now, guys, prisoners, look here, this red red bullet. It is really important. Again, we don't forget this, we don't neglect, and we don't ignore this area. Prisoners. The environment of a prison predisposes a person to different health conditions such as tuberculosis, sexually transmitted diseases, or other infections or communicable diseases. Social determinants of poor health are often present in prisoners. Health concerns are asthma, diabetes, hypertension, heart disease, and mental health problems. C. Infectious and communicable disease are also a concern for this population. D. Healthcare considerations for prisoners. Number 1. The correctional facility is usually the sole provider of healthcare for this population. 2. Screening protocols and procedures for individuals in this setting need to be through consistent and performed regularly. 3. Educational and vocational programs may help mitigate the health problems associated with living in a prison. 4. History of incarceration increase the risk of poor health due to limited opportunities to reform, inadequate housing, employment, and education, lack of family stability. 5. Failure to address mental health issues among this population may contribute to repeated crimes when released from prison. Those who are in prison for life need adequate screening and health care as well. So, another topic, small topic, immigrants and refugees. A, because we are reading population health nursing, so we can expect this kind of small topics. Immigrants and refugees. A, challenges include learning to speak English or the adopted language of their new country, raising children, overcoming cultural barriers, citizenship, employment, housing, access to healthcare, and transportation. Again, so acculturation to the United States increases the risk for poor health. Poor health can be result of eating a less healthy diet, increased risk taking behaviors, and separations from family support networks. See, there are many health concerns for this population. Many results from the process of migration and include infectious disease such as tuberculosis, hepatitis, vector-borne disease, influenza, coronavirus, sexually transmitted disease, and childhood disease such as measles, mumps, rubella, and polio. Antimicrobial resistance is a concern. Number D. For refugees, mental health problems due to war, violence, and rape occurring in camps are a concern. Healthcare considerations for immigrants and refugees. Number 1. A process for offering services and treating immigrants and refugees must be available regardless of insurance status. Refugees may be eligible for short term medical assistance in the United States but then may lack healthcare coverage due to ineligibility for state medical assistance or inability to afford private health insurance. 3. Nurses need to be aware of the limited access to healthcare resources and explore possible healthcare services for this population. Number 4. Vaccination must be provided to prevent communicable diseases. The last topic of chapter 5 now, individuals with chronic illness. Chronic illness is the leading cause of death and disability in the United States. The prevalence increases with age and is a major cause of disability. Again, pyramid point. B. Chronic illness include cardiovascular disease, cancer, respiratory disease, diabetes, mental health problems, vision and hearing impairment, oral diseases, bone and joint disorders, and genetic disorders. So, guys, here just read about it again. Okay, see, poor health outcome and high healthcare costs are associated with chronic illness. Number D, optimal care for individuals with multiple chronic illness may be limited because of the multiple health needs present. E, many health professionals do not feel adequately prepared to manage individuals with multiple chronic illness. F, individuals with one chronic illness are at risk for developing multiple chronic illnesses. Modifiable factors include an unhealthy diet, physical inactivity, and tobacco use. Non-modifiable or fiable factors include age and genetics. H. Healthcare consideration for individuals with chronic illness. Follow-up care is important to promoting health for individuals with chronic illness. Focusing on a single illness does not effectively manage an individual with multiple chronic diseases rather than the big picture needs to be understood in managing these clients. So here guys, again, number 3, interprofessional collaboration is important in safely managing individuals with chronic diseases. Nurses play a key role in facilitating interprofessional communication between providers and specialists. Number 5, inclusion of the client and support persons in healthcare decision help to increase adherence to a complex healthcare regimen. So here is guys our chapter number 5 is finished and practice question already uploaded in the video. Okay guys, just assess yourself you have understood the chapter or not. So here I finished this my reading or my video, and we will start again. So bye for now. Bye.